Okay, pheochromocytoma. It's important to remember that 25% of these are inherited. Now, the pathogenesis of this, you have to remember it's because we have increased catecholamine secretion, and you really have to look out for symptoms like headache, tachycardia, sweating, and hypertension. A lot of the times, they can even cause anxiety, and one of the biggest giveaways is the patient has drug-resistant hypertension and they have hyperglycemia, but their BMI are absolutely normal. Remember, someone can have pheochromocytoma and not have any of these symptoms because only 50% of them actually present with symptoms. Flashing back to step 1, remember that VHL, MEN2, and NF1 or neurofibromatosis type 1 all cause pheochromocytoma, and these are all autosomal dominant disorders. You typically see this in patients who are 30 to 50 years old. And remember, in step 2, age is very important. We all know that to make the diagnosis, you want to check fractionated metanephrines and catecholamines. And oftentimes, especially during a psychiatric evaluation, people can be misdiagnosed, so be careful. Other autosomal dominant disorders, look out for AIP or acute intermittent porphyria. This causes abdominal pain and tachycardia and also peripheral neuropathy. Anytime you see a very odd collection of symptoms such as diarrhea, skin flushing, and suddenly you have a patient with some sort of valvular disease in their heart, think carcinoid syndrome. The reason why I even mention carcinoid syndrome is sometimes when patients have very high blood pressures, they can appear flushed, and I don't want you to get this confused with pheochromocytoma presentation. So you have to always make sure that the whole picture fits. Now, it's very often to mix this diagnosis with generalized anxiety disorder or some type of similar psychiatric issue. But remember, severe drug-resistant hypertension or that hyperglycemia that I mentioned earlier is not associated with psychiatric issues. Also, don't mix this up with anyone with like hyperthyroidism because the episodes in pheochromocytoma are episodic. Not to mention, hyperthyroidism also comes with like weight loss and heat intolerance. Anytime that you see a patient who's presenting very similarly, such as palpitations, diaphoresis, and tremor, but the labs show that they're hypoglycemic, don't forget that insulinoma can cause these symptoms.